Vaccine extremists.
The vaccine.
COVID vaccine.
Vaccinations. COVID vaccines.
Ever since COVID, the word vaccine has become so polarizing. Now, some people blame this on the media, others blame this on the vaccine mandates, but a lot of people are starting to blame the doctors who administer these vaccines. There's a rising belief, especially in parents, that doctors are taught to just blindly give vaccines without question. In fact, there's so much distrust in doctors today that some parents are even choosing to skip their child's routine vaccinations because they believe doctors only recommend vaccines because they're brainwashed to do so. So I decided to do something that no one else has ever done. I'm about to expose exactly what doctors are taught about vaccines in medical school and explain how this affects you as a patient. But before I get into that, let me just explain a little bit about myself. For those of you who don't know, my name is Andreas and I'm a fourth year medical student, and in just 90 short days, I'll be graduating medical school. Now, these last 4 years have been nothing but brutal, non-stop studying in medical school, of course. And because of that, I can honestly and openly tell you about everything I learned in med school, especially when it comes to vaccines. But even though I'm about to be a doctor, I don't want to talk to you like one, so no complex medical terms, no tight-ass white coat. In fact, I don't even know why I'm wearing a stethoscope, but I think there has to be some level of trust before any sort of MD, DMD, DO, whatever. You can throw every letter in the alphabet behind my last name. Credentials don't mean a thing if you don't trust the person who has them. So make sure you watch this video to the end, because when it's over, I'm always excited to read your comments, and I really want to know, after you find out everything a doctor learns about vaccines, do you still think they're brainwashed, or is that just a false narrative? Let's get into it. A lot of people don't know this, but on the very first day of medical school, every student signs a lifelong contract to be a product ambassador for Pfizer. I'm just kidding, guys. This is a joke. Let me tell you what a first-year medical student learns about vaccines. So in my experience during my first year, we didn't start learning about vaccines until we started studying the body's immune system. Now, this was really helpful because if you understand one, you understand the other, because the way a vaccine works is basically a direct reflection of how the body naturally fights off germs. In fact, what you're about to hear about the immune system took me 6 months to learn, but I'll teach you it in literally 1 minute. So to keep things simple, when you put your nasty, slimy fingers in your mouth, you're potentially exposing your body to new types of germs. And when this happens, your immune system gets triggered and it fights off these germs. And it does this by making you feel sick, raising your body temperature, giving you a fever. But at the same time as your immune system is fighting it, it's also studying it and memorizing this new germ. So if you were to get exposed to it a second time, it already dealt with it, it knows what to do, and it'll just destroy the germ without the need for you to get sick first. Vaccines, on the other hand, how they work is that when you get injected with a vaccine, it's basically exposing your body to like a tiny harmless piece of a virus that's so small that you're not going to get sick. But what that little piece does, though, is it trains your immune system how to fight off and protect you against that particular virus that the vaccine wants to defend you from, right? So that way, if you ever come in contact with a larger version of that virus in real life, your immune system has already been trained by that little piece and it knows exactly what to do. It's just destroy the virus, and you won't have to get sick first, and you won't even know you ever had that virus. So after we cover the basics, the next thing that we learned about vaccines in just my first year of medical school is going to shock a lot of you. So next thing we talked about is vaccine side effects, and we specifically learned that certain types of vaccines can be harmful to certain groups of people. When it comes to the side effects of routine vaccines, you have your headaches, you have your rashes, right? You have your fevers. I have to state this, that nowhere in legit medical literature does it state that vaccines cause autism. And I know it's a big topic of discussion. I'm going to bring it up again towards the end of the video. So additionally, we also learned that certain types of vaccines can hurt certain groups of people. For example, if someone has HIV, their immune system is really compromised, right? It's so weak. And like we stated, when you get a vaccine, you're exposing your body to like a little tiny piece of virus, right? And even though it's really small, someone with HIV's immune system is so weak that they might contract that very virus that the vaccine is trying to protect them from. So we typically avoid live vaccines from anyone who has a compromised immune system. Moving on to the second year of medical school. During the second year, vaccines are again brought up, but they're brought up when we're studying population health and bioethics. Specifically, we learn about how vaccine and drugs are created, developed, and then administered to the general population. Throughout this video, I was trying to make it as entertaining as possible and kind of like educate you guys as a byproduct of that. But the information I learned in my second year of medical school is really important, and I just think everyone should be aware of it. Whether you're a drug or a vaccine, they're both subject to the clinical treatment trials, which has 5 phases. All drugs and vaccines have to go through all 5 phases in order to be labeled as safe. Now, the diagram I'm showing you now shows you all 5 phases of the clinical treatment trial, starting at the preclinical phase and going to phase 0, 1, 2, 3, and 4. Now, if you look at the bottom of the diagram, it shows you the average time it takes a vaccine or drug to get through all 5 phases to be labeled as safe. That's typically about 10 to 15 years. Now, this next graph I'm showing you compares the vaccine approval timelines, right? So the time it takes to get through all 5 phases to be labeled as safe of a standard routine vaccine versus how long it took the COVID-19 vaccine to get approved. So as you can see, the standard vaccine is in yellow and the COVID-19 vaccine time is in orange. And what generally takes 10 to 15 years to go through and be labeled as safe took the COVID-19 vaccine just 11 months to be approved. Just look at phase 3 for an example. In phase 3, it generally takes a standard vaccine 3 years to get to the next stage. It took the COVID-19 vaccine less than 6 months. A specific memory I have in medical school and something that will always stay with me is that when we were learning this, the professor teaching this, he kind of like stopped the class and he brought this to my class's attention. He said, listen, it takes such and such time for a vaccine to get approved, and it only took the COVID-19 vaccine 11 months. And like, he didn't like harp on it. He just left it at that and just made sure we all understood that. This whole argument that doctors are just taught to blindly administer vaccines can be tossed out. But I'm going to take it a step further, and I'm going to tell you what else I learned during my second year of medical school. When it comes to patients or parents of patients who refuse vaccines, we learn that by law, the only thing we can do as doctors is just respect their decisions, right? We can only respect the patient's decisions, and we can only like do what the patient wants us to do. We get so many board exams. I'm talking about thousands of questions on our board exams, like bringing this up. What do you do if the patient does not want a vaccine? And the only correct answer is that we must respect the patient's decision and do not offer any unwanted care or unwanted vaccines. Now, moving on to years 3 and 4 of medical school. Now, the information that we learn about vaccines in these years is usually the one that's met with the most criticism by anti-vaxxers and concerned parents. Now, in these years, we learn about the recommended vaccine schedule. Now, this chart I'm showing you basically is exactly what it sounds like. It's the recommendations of which vaccine a person should receive and in which order they should get them in from the day they're born until they're about 65 years old. Now, again, I want to emphasize that every time that we saw this chart in medical school, it's always prefaced with the word recommended, right? So this is just what doctors recommend you should get. And it all goes back to what I said. By law, doctors can only recommend what they think is best for the patient, but it's up to the patient to decide what they want, and the doctor must respect whatever they want, right? Like, you can't just give them vaccines because we think that we should give them vaccines. No, that's not how it works. They have a choice and we have to respect it. Okay, now that we got through all 4 years, let's summarize what's taught about vaccines in medical school. So in year 1, we learned about how they work, what their goal is, and any potential side effects. In year 2, we learned about how vaccines are developed and the importance of respecting a patient's wishes regardless of their beliefs. And in years 3 and 4, medical students learned about the recommended schedule for administering routine vaccines. In my opinion, I never thought that my medical school was trying to like force ideas on me or make me be pro-vaccine or anything like that. In fact, when we learned about vaccines, I always thought that the information presented was always shown in like an unbiased way. But you might be thinking, if medical schools don't force future doctors to be pro-vaccines, then why do so many doctors today recommend them? And the answer is really simple. If vaccines weren't safe, if they weren't effective, doctors would be the first to know. And this is because the hospitals would be filled with patients who were sick from diseases that vaccines were meant to protect you from. Just think of it in terms of like an exterminator, right? If you had cockroaches in your house and you call an exterminator, then like a week later you don't have any cockroaches, it's not because the cockroaches just suddenly disappeared. It's because the exterminator did his job. Doctors don't see much of measles anymore or polio anymore in hospitals, not because these diseases just vanished. It's because vaccines have been working safely and effectively behind the scenes. Just take a look at this graph I'm showing you. This is the impact of vaccines on disease reduction. Because we have vaccines against viruses like smallpox and polio, we saw 100% case reduction. I mean, that's insane. And it's not because these diseases just disappeared. It's because these vaccines work and they're effective, or else we wouldn't see these numbers. Now, don't get me wrong. I fully understand anyone who has an issue with or protest the COVID-19 vaccine, because like I showed you, I mean, it was rapidly developed and these people have evidence on why to be upset. So I fully understand that. What I ask of you is that please don't let your thoughts on the COVID-19 vaccine be your prevailing ideas and thoughts about all the rest of the vaccines, all the routine vaccines, right? And I have an analogy for you. Imagine having 99 real Gucci purses, but you bought one fake Gucci purse from like Temu or something, right? If someone catches you with that fake Gucci bag, they're going to think the rest of your 99 real bags are trash when in fact they're legit. Now, as promised, I wanted to bring up this topic. There was an article written in 1998 by some British guy named Andrew Wakefield, and he made the claim that vaccines cause autism. Now, to keep it short, this scientific study, or whatever you want to call it, was an absolute hoax because first off, this British guy, he was paid $400,000 by a group of lawyers, and the lawyers paid him this money just to make vaccines look bad so they have a reason to sue the pharmaceutical company. And also, it was proven that he falsified a lot of the medical records of like the patients he was looking at. He only looked at 12 people. It was a hoax. Now that you know exactly what doctors are taught about vaccines, let me know in the comment section below if you agree with my take or if you still think that doctors are brainwashed. If you enjoyed this video, make sure you smash that like button and hit subscribe so you never miss a video. Thank you for watching and stay healthy.